Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Okay, I want to shift to my son is 7 and diagnosed with high-functioning autism, ADHD, and anxiety. He has trouble regulating his emotions and relating to others. What do you recommend? And they're saying, should I find a local card office?
Oh, it's so hard when you have kind of the combination of those three, and it is more and more common, I will say. Yeah, well, you don't necessarily need to find a card office. That would be great if we are in your area. Clearly, we can help. But you should probably start with an assessment. I feel like using the skills assessment to kind of identify exactly what's going on with your child and what their needs are is your first step. So there's let's talk about each of those things. With autism, you are going to be lacking, and it's high functioning autism. So your child's going to be behind on advanced skills. And those are things like cognition, that thing that I was talking about in regards to being able to take other people's perspective, understanding other people's desires and beliefs and goals and all that. And you're also going to have some issues with executive functions, so problem solving, planning, those types of things. And you're probably also going to have some deficits in the social area. So just social communication, being able to go back and forth and interact with peers and know how to behave in different social environments, all of those areas. So once you do the skills assessment for your child, you'll get a load of lessons within those areas and anything else he might be missing, by the way. So, whether it's language or academic or fine motor, gross motor, it doesn't matter. It's all there. So you'll have the ability to have kind of a list of lessons at least, and that will help with all the issues that could possibly be resulting from the autism diagnosis. Now, the ADHD diagnosis would lead to hyperactivity, perhaps. I don't know which type of ADHD, if it's a hyperactive type or inattentive type or a combined. There's 3 types of ADHD. Assuming that there's hyperactivity, I promise you that when you get into an ABA program, it'll help because it really structures and regulates your child's environment. But if it's an excessive amount of hyperactivity, you will need to see a physician, a psychiatrist, or a developmental pediatrician who will be able to help you with medical help as well. With ADHD, if it's very severe, the inattentive type of ADHD, a lot of the ABA lessons will really help. But severe hyperactivity, and I have seen children with severe hyperactivity, it's extremely hard for them to sit for a minute to learn. They are just fleeting all the time, running back and forth, and it's really hard for them to focus. And medication does help with that. So, and there's very good medications now for that. So I would, for the ADHD portion, your way to go is not just the ABA, but perhaps seeking out medical help as well. So that there's a combination of, there's a medication like Adderall or Ritalin or even more advanced ones where your child is calming down enough and now the ABA is effective and is helping teach. For the anxiety, you'll need a combination of what's called cognitive behavior therapy and perhaps medication. It depends on the level of anxiety. By the way, the issue that you'll have is that some of the medications for ADHD actually make anxiety worse. So you sort of need to see a psychiatrist who's going to really work with you, really understand your child's issues, and then also help you interact with an ABA organization so that you can get the ongoing ABA, but also some help with medications that'll help your child calm down a little bit. and perhaps pay better attention and not be as anxious. Medications for anxiety are antidepressants. They work for anxiety. And so you really would need to consult with a psychiatrist and as well as get involved with an autism ABA program.
And because we've had many questions that I haven't gotten to yet about biomedical, but especially for people whose kids are exhibiting ADHD, there's a large growing school of thought about making sure that you reduce the level of pesticides in their diets. Just want to throw that out there that
and I'm glad you said that, Shannon, because we do see a lot of hyperactivity in kids, which is suddenly improved when diet is changed. It's not pesticides, but also food coloring, sugar, of course, anything that you're allergic to. All of those types of things can make hyperactivity increase.
There we go. And perhaps soon we'll talk more about that. But hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.